السلام عليكم، يعطيكم العافية. الله يعافيكم جميعا. يعني بجوز هاي آخر محاضرة وقبل اللانش، فدائما هاي زي ما حكوها بحاول الواحد يستعجل فيها. أنا الصراحة يعني أنا الدكتور محمد السبوع، Professor in Clinical Pharmacology and Precision Medicine بكلية الطب بجامعة مؤتة. I will give you my lectures about handling rare and orphan diseases. ليش اخترنا هذا الموضوع؟ اخترناه لأنه I have experience with a specific rare disease. It's called alkaptonuria. It is rare outside Jordan, but in Jordan it's very common. We identified so far about 100 cases of alkaptonuria in Jordan without doing screening. So I have a slide and explain how my patient, they were involved in international clinical trials, and they received a very expensive drug called nitisinone during this trial. So in my presentation, I will talk about the definition of rare and orphan diseases and the prevalence of orphan diseases worldwide and in the MENA region. The reason why we have high rate of incidence of rare and orphan diseases, it's due to high rate of consanguinity and consanguineous marriages. And I will talk about there is a surge in interest in research area of rare and orphan diseases, what are the challenges, and the effectiveness and safety of orphan drugs from evidence-based review. And finally, I will talk about the international clinical trial. As we all know that rare diseases are rapidly expanding area of research globally, and advances in genetic technologies and genotyping techniques have led to improvement in identification of patients with rare diseases and diagnosis of patients with rare diseases and providing treatment for patients with rare diseases. So we have a new treatment for rare diseases. However, we all know that orphan drugs, they usually have higher prices, so they are very expensive, and this is why they are usually not included, and patients, they don't have access to these what we call orphan drugs. So orphan drugs are drugs that are used to treat patients with orphan and rare diseases, and this create a challenge for the healthcare system, for the payer, for the healthcare providers, and for the patient and their families as well. So in the US, it's estimated that about 30 million patients, they are diagnosed with rare and orphan diseases. And in Europe, the same, about 20 studies have shown that about 30 to 25 million, they are affected by rare and orphan diseases. So overall, there are about 350 to 400 million people worldwide, they are affected by rare diseases. We have about 7,000 rare diseases have been identified. However, we have treatment for only 5% for these diseases. In the US, rare disease is considered rare when it affects less than 1 in 200,000 individuals. And in Europe, the disease is called rare when it affects about 1 person per 2,000 cases. Regarding the market for orphan drugs, there is a significant acceleration in the market for rare and orphan diseases. The sale market for orphan diseases was about $100 billion in 2015 and expected to be higher by 2020. Now, this interest in rare diseases have led the companies to invest more in clinical research in orphan diseases. So governments, they have incentive to promote research in the area of clinical research, better availability and understanding of the natural history of rare diseases. And there is a big increase and the growth of patient organization and patient advocacy group funded a project for rare diseases. And as I said, I was involved, and Jordan, we have Jordanian Al-Kaptanura Society was involved in finding a treatment for this rare genetic disease. What are the challenges that facing development of rare and orphan diseases? As we already know, orphan diseases, we have small population size, so usually we have very low prevalence of these diseases. There is a lack of understanding of the natural history of these diseases, because usually they suffer from chronic and severe manifestation of these diseases and different phenotypes. We also have a lack of previous clinical trials. However, we have increase in, as we said at the beginning, we have clinical increase in clinical trials for rare diseases. So this slide shows the interest of clinical trials in the MENA region between 2008 and early 2009. So we can see that there is increase in the interest of conducting clinical trials in the region. Now, this is a nice study published in 2015 in British Medical Journal. They assessed the effectiveness and the safety and cost effectiveness of orphan drugs approved by the EMA. And they found that 74 drugs were approved over 12 years period. Fortunately, about 85 of these studies, they had significant clinical benefits. Regarding the annual cost, it was ranged between about 700 pound to about 370,000 pounds. So there is a wide range of variations. About quarter of these drugs, they were cost less than 10,000 pound annually. However, the majority of these drugs, they were between 10,000 and 100,000 pounds. Now I will talk about our region. As we said, we have many cases of rare diseases in Jordan and in the MENA region in general. It is estimated that there are about 3 million patients to suffer from rare disease in the region. And we have a high incidence of these rare diseases because of, as I said previously, due to consanguinity. Studies have shown that consanguinity varies between 25 and sometimes up to 60%. And this has led to increase of rare disease and especially autosomal recessive diseases. And as we know, many patients, they do not have access to these orphan drugs. Yes, I'm finishing now. We in the region, we have lack of registry, as Dr. Munir said, in rare and orphan disease, and we are working to develop a registry for orphan and rare disease, and we started with this disease, Al-Kaptanuria. And finally, we have to increase our involvement of our patient in rare and clinical studies. I just want to show you our experience with this disease. I will finish, doctor, with this slide. So about 20 patients from Jordan, they participated in international trials. It was funded by the EU, 6 million euro, 12 countries from EU and Jordan. And our patient, they had access to expensive drugs. It's called nitisinone. And last month, it was approved by EMA to treatment patient with AKU. And I will leave you with this nice paper. It's called Orphan Drugs, Expensive Yet Necessary. And thank you for your understanding.